Welcome to another Brookwood Baptist Health exclusive. My name is Brian Pavlik. Thank you for joining us. And we are continuing our celebration of 100 years, a century of caring at Princeton Baptist Medical Center with Brookwood Baptist Health, as we are interviewing some of our employees and people who have just made a wonderful impact on that hospital over the course of 100 years. And the majority of the history of Princeton probably comes from the lady sitting with me today, whether it's her impact, whether it's her stories, just the way that she has just embraced Princeton, called it her home for many years. It is a dear friend of mine, Miss Juanita Williams. Juanita, it is so good to see you. How are you today?
Good. Thanks, Brian.
You're welcome. It is always so fun to talk to you. You are Miss Princeton. I don't care what people say. And we'll get in a little bit of how long you've served there and such and your title. But Juanita is just one of those people every single day that lives and breathes Princeton. And it's just so important for her to be one of our first interviews to tell you about what Princeton means to her, how she's seen it grown over the years, because she's been there a hot minute. So Juanita, we'll get into it right now. Just introduce yourself. Tell us who you are, how long you've served at Princeton, your title, and just any other little snippets of things that you think people need to know about you, girl.
Okay. I'm Juanita Williams, and I'm here at Princeton Baptist Medical Center. I've been here for 42 years.
Unbelievable.
The first 10 years as a social worker. So I came to the organization as a social worker, worked alongside the doctors, was part of the clinical group, and was, if you want to call it, the product of Princeton.
Yeah.
Then after that 10 years, I switched over to the physician relations that I'm now currently working in for the last 32 years.
Yeah.
So total 42 years. So it has been a great situation for me. When I moved from patient care to physician care, I might say.
Absolutely.
I worked with them to make it smooth for our patients. So I still feel like I'm doing patient care in a roundabout way. And we want to make sure that the patient has a good experience. We've always been a faith-based institution here. We want to make sure we love on them. Princeton has been known for its TLC, from the nursing care and staff care. So that's part of our culture. So I think that if anyone has a problem outside the hospital, from that angle, I'm one of the ones they call. So we want to make sure that that experience is a good one for them, and particularly for the patient, so they can get better and get back to their lifestyle.
For over 40 years, she lives the motto, other duties as assigned, when it comes to Princeton. That's her right there. Juanita, you talk about 42 years ago. My goodness, it's for you, you're probably thinking, man, it was just yesterday when I first stepped foot on the campus. But what initially, all those years ago, attracted you to Princeton? Was it something that you grew up around? Was it somewhere you wanted to get into healthcare? Just what initially attracted you to starting your career at Princeton Baptist Medical Center?
I actually am from the west side of town. So I'm from Hueytown, and that's near here, near Princeton. Also, though, I had been working as a social worker in other institutions.
Okay.
So I had they had a need here for a social worker at the time. And a friend of mine called and said, hey, would you like to come work there? And I said, oh, yes, I would. I've heard good things about Princeton. I would like to come over. So she just, I left one hospital on a Tuesday and came here on a Wednesday in 1980, and I've been here ever since. So it's, that kind of started it. I just introduced myself to people and got going. I loved Princeton too, because we have, for a community hospital, there's a lot of things going on. So we have a lot of research going on. We have the residency program. So everybody has to stay, on their game. As you know, residents ask good questions and ask hard questions. The hospital has always been helpful in the community of training other nurses and other health professionals. We used to have a radiology tech school here. So we've tried to, raise up the next generation. So with a lot of that, you think that happens in academia, but it doesn't always. So this community hospital has been real in this community for 100 years, same location for 100 years. And we've been trying to meet the community's needs. And when we say community, not just the surrounding area, but the healthcare community, and that you're raising up new bodies and new talent to take care of folks in the future.
If you don't mind, stay with that theme of community, because that is one of the questions, and that's one of the things that made Princeton successful. You can't get to 100 years old if the community doesn't support you, or if you're not involved with the community. You say behind me, a community built on care. I know Princeton lives that motto, but describe a little bit more about Princeton's impact on those communities. I see you all the time out there at those health fairs or those events in churches, and sometimes they're at nice weekends on the park and things. But just talk a little bit about how Princeton positively impacts those surrounding communities, not just right in the immediate neighborhoods around it, but also extending out to your hometown, Hueytown, and those areas kind of down 459, 59 and stuff like that.
I think that we want to make sure that there's a lot of education. People tend to be more compliant if you're a patient, if you understand better. Also, just awareness of some prevention, some things that you can do to help yourself as a patient. And so Princeton has reached out in the past and continues to do so. I've got a health fair tomorrow.
Yep.
To try to get education out and to try to answer any kind of questions that people might have to better their health. We've done that in a lot of different ways. We helped the Rump Shaker 5K get started from its existence because the patient was actually one of our patients that had colon cancer. So we've helped that group, reached out and helped them get that run started. So now that's a big race here in town. It helps do a lot to promote colon awareness, colon screening awareness. And actually that's this month, March. So that's what we're doing this month. So we had the giant colon come to the hospital, be placed in the hospital, had our doctor's offices and GI folks talk to patients as they went by, visitors that went by, trying to educate, had information there, you know, that kind of thing. So each month there may be a different theme. February was a heart month, of course. So we try to do that on an ongoing basis so that we can provide for that need.
Yep. And that's you and just your expertise over the 42 years of getting out, knowing the communities. I mean, again, knowing what you're talking about, you do that so well. And I can only imagine what you've seen change in 42 years. And I'm not just talking about additions to the hospital, new POBs or annexes or wings or any entrances, and then machinery. I'm thinking even as far as some of our diagnostic imagery, and then of course procedures, doctors, people, all that good stuff. You've seen a lot. Many things change obviously in 100 years, but what is one constant vision or value that you personally have seen at Princeton that has kind of remained, not just over 42 years, but you just know it was based 100 years ago and it just has continued through up to here, March of 2022?
I would say putting patients first.
Yeah.
And Ida V. Moffitt School of Nursing is actually 100 years old, started here first. And so that was her mindset. And she said, you touch the patient, you love on them, you listen to them. And so we've tried to send that message down through the generations that have been here after her. There's also the School of Nursing. They still teach that. And we have a lot of graduates here from Ida V. Moffitt School of Nursing. Yeah. So we want to make sure that that's handled. But I think that when we talk about it, when doctors are in committees and they go, well, we want to make sure our patients get so-and-so, or we want to make sure that they, you know, they're being taken care of, or is this going to help the patient care? Is this redundant or streamlined so it helps the patient? And so they think patient first.
Yeah.
So I think that's the one thing that I think has maybe helped with continuity of attitude, is the patient comes first.
Yeah, that quality of patient care. You won't get anything better, especially on that side, than Princeton. I mean, it's a wonderful community. I love just walking around. It's just a beautiful campus, and the people just really highlight it as well. Even on a dreary day, it's just such a wonderful place. The smiles, like Juanita and her personality. I mean, it's just full of people like that. And, you know, as I close my time with you here, Juanita, and again, thank you for so many memories, friendship, personally, obviously, and just all you do to just be a focal point, a standout at that hospital. You are somebody that people look to for advice. I know I come to you for advice on different things. So if this video all of a sudden was put into a time capsule, and 100 years from now, on the 200th celebration of Princeton, they open it up, what is something that you would tell them here, March 2022? What is one piece of advice you would give Princeton employees who will serve our communities over the next 100 years of this story at Princeton? What would be that one piece of advice you would tell them?
I think I would tell them to put the patient first
Right.
and take care of each other, because
Yes.
we're a family and we can help each other, jump in. It doesn't have to be in your job description. Sometimes you just need to hug an employee.
Mhm.
The other day I was walking down the hall and we had someone who'd been working with a lot of the COVID patients, was just completely worn out. And when I told her she's doing a great job, she just leaned into me and we stood there and hugged, and people just kept walking by and patting us on the back and just let us hug. And, you know, you need filling up. So you need to be there for your, your coworkers too. So I would say patient first and then be there for your coworkers. And that includes the physicians and the whole staff.
Absolutely. We're a hospital, not just for patients. We take care of each
Right.
other and we heal each other. Absolutely. Great advice, Juanita. As always, I just enjoyed my time with you. I know today's a little shorter than our normal conversations, but it is a lot of fun just to hear from you and see you and get your advice. And of course, just being, again, just such an inspiration for Princeton and just a wonderful representation of why we've made it 100 years. So I do thank you for your service. And, anytime you want to call me, you can. So I will say thank you for Juanita. I will say thank you for myself and for Princeton Baptist. Thank you for allowing us to celebrate 100 years of serving you. And we are your home. If you need anything, please, Princeton is right here. The people, we are just willing and ready to, as Juanita said, embrace you, love on you, take care of you, both physically, mentally, spiritually as well, and all that. So for the next 100 years, we hope to keep taking care of you as a community built on care. For Juanita and myself, thank you very much, and we will see you real soon.